Awesome man. It is important to be firm on both ends. One end is technology, the other one, you'll only know if you try. I never imagined I would time travel. Traveled back to the 1990s. On the young man with the same name as me, and he is also a doctor. In other words, my current clinical experience. But far more than the level of this era. Very good. Master this advantage. There's absolutely no need to worry. Do you know, I heard our department is about to disband us. Which one didn't fight tooth and nail? Now they all have to be packed up, sent to other departments. Why? Okay, that's enough. Although being transferred there was not well received, at least I won't lose my job. Who can argue with that? We're considered lucky. That newcomer, Jiang, only been here for 2 months. Can't do anything. I can't even hold a wooden knife steady. I'm guessing I'll get bullied a lot. Jiang, you're here pretty early today. What a hardworking and capable young man. I'm still relatively inexperienced. We should learn more from our seniors. Only then can one make progress. This young man is really open-minded. Doctor, please save my father. He's about to die. What? Patient condition. How did it suddenly deteriorate like this? His cirrhosis had stabilized previously. Look at him like this. Like oxygen deficiency caused by difficulty breathing. Call an internist. Our general surgery. I'm not responsible for this part. Cheer up, old man. You absolutely mustn't fall asleep. His life was in danger at any time. Where is the director? Hurry up and ask the director to come over. The doctor is still in the operating room. Human life is of paramount importance. That's it. We're doomed. Please wake up, Dad. Don't scare me. Completion. This matter is not handled well. I'm afraid there will be even more dissatisfaction. Then can I be transferred to another department? Please move aside. Syncope. Difficulty breathing. Blood return obstructed. I see. Prepare syringes and sterilization supplies immediately. I need to use it now. Patient's symptoms. This is a manifestation of cardiac tamponade. The cause of this disease. It is often a buildup of fluid. This leads to increased intracardiac pressure. Compression of the heart restricts its diastolic function. It could very well lead to death if it's too late. The patient needs to be punctured immediately. If it drags on any longer, he will suffocate from the accumulated fluid. Quick, he actually mastered pericardiocentesis. This is one of the most difficult invasive surgeries in surgery. This surgery cannot afford the slightest error, otherwise it will pierce the heart. Extremely life-threatening. But Dr. Jiang remained calm and composed. Mature and steady technique. They actually did it. Oh, that feels so good. I almost suffocated. The surgery was successful. The patient had clearly fallen into a coma. It's actually really healed now. You, a mere intern. I've hardly ever touched a scalpel. They were able to perform the puncture so perfectly. This is considered by the industry to be the most difficult pericardiocentesis. What a pity. Jiang, I never imagined your medical skills were so good, but now the department is about to fall apart. A rare talent like you, they may not even be given important responsibilities. Don't worry about me. I'm prepared. Finally found you. Dr. Jiang. Director Wang called and said, a patient needs surgery. They're asking you to come over and help. I was a new patient when I first entered the hospital. It shouldn't have been my turn to perform the surgery. The director called me over. It probably means they want me to help them. Learning experience. Coming right away. The pregnant woman in bed 5 of the ward. There was also an elderly man who had just undergone a pericardiocentesis. Please keep an eye on things later. The others are doing alright for now. In case of any emergency, contact me anytime. If you can't find it, call the operating room. Okay. I understand. Dr. Jiang. These are the doctor's orders for patient 5. Please sign here. Dr. Jiang, my pen. Excuse me. I'm used to it. Sorry, director. A patient just had an emergency. It took a little time. Sorry to keep everyone waiting. Jiang Chenggang, you're the one to perform the surgery today. Director Wang, this is inappropriate. Dr. Jiang is still relatively inexperienced. You trust him so much to be the surgeon in case something happens. We have no way to explain this to them. That's right. If it were a regular surgery, that would be fine. This is an emergency at night. Let a newbie take the lead. The director's decision was extremely ill-considered. What if something goes wrong? No need to persuade me anymore. Jiang just needed surgery. I will still be in charge of the surgery. If from under the master, people taken out, they can't even do a proper skin opening. I'm afraid, master, I'll be laughed out of my head. I understand master's intention. However, this unconventional training method. What if someone finds out? It's also bad for the master's reputation. Director, let Jiang observe and learn first. After that, Jiang Cheng just took office. Director, please rest assured. I will do my best. Please point out any shortcomings. Okay. Let's get ready and begin. Jiang Chenggang is a top student from a prestigious university. I was originally thinking of taking him out more often, but now the department is about to be disbanded. There's really not that much time to take it slow. Jiang Chenggang, I will help you complete the surgery. Don't worry. Do as I instructed before. Director Ming. Jiang Cheng just made the cut. That's too reckless. The director comforted him. It's because we are worried that his nervousness might affect the outcome of the surgery. That kid is something else. They started surgery without even looking at the patient. Are you scared out of your wits? This child is too hasty. So eager to make the cut. Please don't damage the nerves. Otherwise, even if the surgery is successful, there will also be after effects. That would be a big problem. I didn't see that wrong, Did I? He actually did it on his first try. Such a perfect cut. This technology, comparable to when I went for further studies before. Those industry leaders I visited. He was just an intern. You cut so well on your first time using a knife. Coincidence? Threading. Amazing. Although it was just surgery, position where the knife can be inserted, control of power, and the technique of sewing, both can be considered textbook level. Jiang Chenggang's operation. Even if I give it my all, it's not certain that we can reach that level. It's not that it's impossible, but rather that it's certain it won't be achieved. Annoying. Go away, director. This incision was really well done. Zhao Jiang. Your technique is something you learned at your university. Did Professor Shen Qian teach you? Oh, I didn't see that wrong, did I? The director was surprisingly gentle. When our batch first arrived, who hasn't been scolded by him? He actually praised Jiang Chenggang today. Director 1 also knew Professor Shen. It seems my guess was right. No wonder your skills are so exquisite. It turns out he was a student of Professor Chen. When I went there for further studies years ago, I was fortunate enough to witness it in person. Professor Shen Qian performs open abdominal surgery. Professor Shen only made one incision back then. It's truly astounding and I have to admit defeat. I guess so. Good, Zhao Jiang. You continue. I'll be here assisting you. Today I'll figure it out completely. How talented is Jiang Chenggang? What's going on? The surgery is progressing well. How did he suddenly become critically ill? The patient's heart rate was 45 beats per minute. Blood pressure 65/45. Use MHG. Even patients undergoing general anesthesia. There shouldn't be such dangerous vital signs. Could it be that the internal organs were damaged during the recent surgery? This is what causes heart rate and blood pressure to rise. Double draw. Otherwise, how can we explain it? What's the current situation? This doesn't make sense. Even the patient's peritoneum was not touched. It won't damage internal organs. I remember before I started making the incision. Unauthorized alteration of anesthetic dosage. I'm worried the patient might wake up if it goes on too long. The dosage was increased. How much did you add? The dosage of these anesthetics and analgesics you administered, they can perform a complex surgery. But our surgery today, it was just a simple cesarean section. Or is it? Do you think this surgery is too complicated? Director 1 is not competent. Do you think there will definitely be unexpected problems arise? Therefore, they added the medicine without authorization. This can cause the patient to not wake up. How could I have guessed that Jiang Chenggang? They really know how to do open abdominal surgery, and it was done so perfectly. He even precisely controlled the amount of bleeding. I thought something was bound to go wrong. It's turned into a bloody mess. Excuse me, I will adjust the dosage now. Fortunately, Jiang Chenggang reminded me. Otherwise, it will cause big trouble. Wait a minute. He's clearly a new intern. He's even proficient in knowledge of anesthesia. That's unbelievable. Before time travel, I'm ranked number 1 in the province, working at a top-tier hospital. In our area, not only academic qualifications, both technical skills and scientific research must be up to standard. Even every department of internal medicine, surgery, obstetrics, and gynecology, they all came easily. Anesthesia is also a piece of cake for them. Based on my clinical experience, in this era, it was an absolutely crushing victory. Vital signs have recovered. Why? What's wrong? Are you not going to continue? Zhao Jiang. Isn't everything going very smoothly for you? Why did you suddenly stop? Director Wang. I'm still relatively inexperienced at our hospital. Exploratory laparotomy. Theoretically speaking, it is not possible to perform the entire surgery. Hospitals are places with strict rules. Even if my skills are super, we must also follow the procedures. I am now in the open. It's just interns who have been here for a few months. Minor surgeries are also possible. Even if I complete the exploratory laparotomy, people will also gossip about it. Think things through before you act. Follow the rules. We cannot act on a whim. Zhao Jiang. You're right. Your surgical technique was absolutely perfect. I was completely engrossed in watching it. I subconsciously assumed you were at the director level. I'd forgotten you before coming to the hospital. Not long. Zhao Jiang. After today's surgery is over, I went to see the hospital leaders. Have them promote you to a higher level. Thank you, Director. Jiang Chenggang. This young man usually looks smiling, heartless. Who would have thought he'd be so reliable at work? Smooth and flawless. He's simply a genius among geniuses. Director, let me help you. Did I give you permission to speak? Surgical retractor given to me. And gauze. The abdominal exploration will now begin. Closely monitor the patient's condition. In case of any situation, increase the speed of the equilibrium fluid. Good. So worry-free. I didn't even have time to look forward to it. Zhao Jiang then proceeded with the next. Everything that needs to be done has been arranged. I never imagined I would live to see this day. I can actually finish it. Such a smooth surgery. If the province holds another seminar next year, having experienced today's surgery, it would be hard for me not to get good grades. Prepare instruments. Now we begin the intestinal adhesion lysis procedure. Estimate 5 minutes for suturing. It's time for suturing so soon. How long has the surgery taken? It's been less than an hour. This requires stitching. Previous exploratory laparotomy, it clearly took 3 hours. This was so fast, it was unbelievable. I was originally thinking, I'll be busy until the early hours of the morning. That's good. Finished so early. Who can argue with that? We finally don't have to work overtime today. I need to get some rest when I get back. I didn't see that wrong, did I? I originally thought that if Jiang Chenggang couldn't handle it, I can replace him. Back to the position of assistant. In the blink of an eye, the surgery was over. That's an exaggeration. Previously, every time I performed an exploratory laparotomy, it takes several hours. It's so fast today. The stitches were put on 5 minutes later. How could that be? The director confirmed there were no problems. Let's review it again. You're questioning me. You're pretty good in every way. His character is also reliable. His only weakness is his surgical skills. The technology is really not that great. They are all hooks. Compared to Xiao Jiang, the difference is too great. Okay. Insert a drainage tube. Arrange the rinsing work. Xiao Jiang will do the stitching. Come here. Unconvinced. They still question whether my arrangements were inappropriate. I am not. Putting aside other things. Just regarding the laparotomy. Tell me what Xiao Jiang did. What's different from before? The key is the location. It turns out that Xiao Jiang chose left rectus abdominis incision. We used to ensure the surgical procedure proceeds without obstruction. I've always used the midline incision. That's right. This means that Xiao Jiang had already figured it out. The patient has left-sided obstruction. Cut from the left side. This can save a lot of trouble later. If Xiao Jiang's qualifications allow him to do the whole process, this surgery is entrusted to him. He will be more perfect than me. Every cut was flawless. Strong wind. You should learn more from Xiao Jiang in the future. His potential far exceeds that of others. If I'm not mistaken, he can even lead our surgical team. A complete makeover in the hospital. Director, this is outrageous. Who knows? Jiang Cheng just picked up from the moment the scalpel touched. I understand. It's time to take the stage. It's up to you young people. The surgery continue. I have to go now. The director is right. Jiang Cheng just did. It is indeed an opening on the left side. What's wrong? Teacher Jiang, is there a problem? Jiang Chenggang 1, are you still there? This patient is someone I see at our hospital. The first one I took over. I'll wait a little longer. Wait until he wakes up before leaving. You're so meticulous. Today's surgery. This is the first time I've encountered this since I started practicing medicine. The most efficient game ever. Fast and accurate. Even our director, they all left without worry. We doctors, no matter how detailed, it's never enough. Teacher Jiang, I just saw you. I've been observing the incision. Is something wrong with what you did? I'm so sorry. Xiao Jiang, I shouldn't have doubted you in the first place. I just have something to say. I just can't figure it out. How did you figure it out so quickly? The patient's affected area. Where is it? You mean this? Look, take the patient's medical history, linking it with the test results. Observe the location on the report again. It's very easy to draw a conclusion. This is no simple matter. Just look at the patient's physical signs. The lesion can then be deduced. How much clinical experience do we need to accumulate? Only then can it be done. In this industry, top-tier diagnostic capabilities. Always an internist. Jiang Cheng is a surgeon. Such a short time. It enables one to integrate and apply knowledge. Ordinary people are simply no match for it. Xiao Jiang, you're really something. The surgery was not only efficient but also of high quality. Teacher Jiang, today's situation, it doesn't necessarily have to be a huge opening. Only then can it be treated. I know a method. It can shorten the time even more. It will not affect the effect. What method? Laparoscopic techniques can be used. Xiao Jiang's method. Let's not mention Corey. Under the director's premise, Director Wang disagreed. Could it be? What does Corey have? My unknown past. Logically speaking, laparoscopic technology in this day and age, although it has only been around for a short time, but we shouldn't be so resistant to it. One is the traditional method of cutting open a large knife. One is minimally invasive. This is clearly the old versus the new in technological change. That's not quite right. Actually, this matter. Could it be Director Wang previously gave patients? I have undergone minimally invasive laparotomy. Yeah. They messed it up in the end. If I had stopped the director back then, it's better not to do it. It's not that bad. Let him get involved in this mess. It's gotten to this point. Think about it. Such an expensive instrument. The entire hospital is waiting to see the results. Who would have thought something would go wrong? Not only was he punished, it was even used as an excuse to make a fuss, to disband our department. You don't know our director? How many words have been whispered about me? They all questioned the director. He said he took kickbacks when buying equipment. They don't care whether the patient lives or dies. Unfit to lead our department. But that's not the case at all. In order to perform that surgery, the director hasn't slept for several days. Keep practicing, just to push the technology out. But somehow, the surgery has just begun. The patient's heart stopped beating. There was no way to save him. Only by returning to this era. Only then did I understand the initial advancement of technological innovation. How difficult. As someone who has benefited from this, it must be clear. Benefits of laparoscopic technology. Even if it's just for myself, this technology must also be made. Apply. Teacher Jiang. The batch of laparoscopic equipment we bought. Where is it now? Where else could it be? All the money has been spent. The equipment supplier won't give a refund. Can only be thrown in. Our warehouse is just gathering dust. That's great. It saved me a lot of money. I was originally thinking, how can I get laparoscopic equipment? This works. It saved me more than hundreds of thousands of yuan. The patient woke up. Teacher Jiang, I'm on duty today. I took the patient back to his room. You can go back and rest now. Okay, then you have to put in more effort. Hey Lao Jiang. Oh Jiang, are you there? There were surgeries today too. It's just a minor surgery. Hey Lao Jiang. He's being modest again. People in our department who can perform surgeries themselves. Just those few. Oh Jiang, you're here with me. It definitely ranks among the top. Zheng Wu. Don't think I don't know. What are you planning? No way. As long as the general surgery department does not disband, I will always be a general surgeon. Oh Jiang, I didn't mean that. Why? Our director today. I just had a very serious surgery. Should we go and observe? How powerful can it be? Could it be? It is known as the king of cancers. Gallbladder cancer radical treatment wood. This handmade piece is general surgery hand wooden sealing. Pancreatic choduodenectomy. It may not be much more complicated than that. Our industry. One of the most advanced surgeries. Oh Jiang, aren't you interested in this at all? Come on. Once this opportunity is gone, it's gone forever. Maybe you end up in hepatobiliary surgery someday. It can be used too. Our lifelong pursuit as surgeons. You don't want any of it. Hey, let's go. This person is no ordinary person. Looks quite enthusiastic. In fact, the target is only Jiang Chenggang. In front of me, an outsider. They blatantly undermine him. That's far too unscrupulous. He was either deliberately provoking us, or maybe they didn't put it at all. Jiang Chenggang took it seriously. There is definitely another intention. What are you pretending for? Does he really think he's so great? If it weren't for our hepatobiliary surgery department was just established, there is a serious shortage of personnel. I'm too lazy to come myself. Trying to win over someone like Jiang Chenggang. Having been to the hospital for so many years, until now, I've never had a level 4 surgery myself. Calling him trash is an understatement. Ridiculous. Your general surgery department, basic laparoscopic surgery. What kind of technical content is it? It's not worth mentioning at all. How can it compare to ours? Gallbladder cancer radical treatment would. Once I master this technology, the position of Deputy Director of Hepatobiliary Surgery, it's still easy to control. Oh Jiang, come quick, right here. It's out. Well, this is not. Patients undergoing radical cholecystectomy for gallbladder cancer. What's the rush? Absolutely foolproof. Outdoor. The chief surgeon is high-priced poaching. I heard it's very powerful. That is, media and hospital staff. They're all waiting outside. Guaranteed to be feasible. Gallbladder cancer radical cure is just a matter of wood. It should be very simple. Even if the tumor is related to the surrounding organs. More adhesion. It shouldn't have taken this long. The whole day should be over by now. They also contacted reporters from the media. Come and wait for the report. I only know today's patients must be young and have mild symptoms. They can't even handle these easy cases. TSK. The technology of this era. That's really backwards. Slower is fine, as long as it ends smoothly. Director, didn't you go to rest? Xiao Jiang is back. Xiao Jiang is back. Just send the patient back to the room. Take whatever catches your eye. You are welcome. Take them all. That's fine too. Then I shall respectfully accept your offer. This is all me. The book I finally bought after searching for a long time. Most of them are out of print. You can't find it even if you spend money. You little brat. I feel like I got the short end of the stick. Oh well. Oh well, I'm already this old. Limited energy. Not as good as you young people. How to outperform others? Why haven't they come back yet? I can't just tell the director. Jiang Chenggang and Jing Wu, go study. The director would definitely feel uncomfortable hearing this. After all, Jiang Chenggang, but his longest-serving apprentice. He secretly went to observe other people's places. If people find out, they'll probably gossip. Teacher Jiang has been busy all day. I noticed he wasn't in good condition, so he went back. Oh, I see. Xiao Zhong's reaction is abnormal. Jiang Chenggang must still be in the hospital. This kid thinks I can't see through him. Even if there were many things to do before the surgery ended later, Jiang Chenggang will definitely come and tell me before you leave. As a result today, just a surgical procedure for radical treatment of gallbladder cancer. Let him linger and never want to leave. Well, Xiao Jiang has something to ask you. If our science club really falls apart, what are your plans? Director, I haven't thought about this yet. Our department is very good. Everyone took good care of me, but I'm making an exception and letting you have surgery today. I'm just worried you will come to other departments because I've never handled a knife before to be looked down upon. You have great potential right now. Completely exceeded my expectations. If you've thought it through later, you can tell me. I'll apply to the manager on your behalf. If you want to go to other hospitals, I can also try to find connections. I'll send you to the provincial hospital for further training. He's a useless old man. Actually, it is still possible. Say a few words. Director, it doesn't matter. Don't take it to heart. Take your time to think it over. There's no rush. After all, it's far from the top 3 in terms of creation and review. There's still some time. Our department can hold on for a while longer. Director, if I say I have an idea, how can we keep our department from disbanding? Yeah. Xiao Jiang, say it again. Director, our department will not disband. No one needs to leave. The current situation. You're not kidding me. I'm serious. The review is just a minor matter. Back then, in order to figure it out, the art of judging, even in the 1990s, the most original version of the review rules, they've all been thoroughly studied, not difficult. So for me, this relates to general surgery, the review of everyone's departure and retention, just destined to never fail. It's just a game. Is this true? Xiao Jiang, tell me quickly. Director, do you know that, based on the current situation, creation and review rules, what are the 2 most crucial points? You say, yes, the number of times a 4th-level handheld wooden object can be performed independently. Second, the number of new technical trees. These 2 points are extremely important at present. Regarding the first point alone, this level of surgery, it mostly depends on fate. High risk factor. Quantity cannot be guaranteed. Director, you are aware of this as well. You mean we need to rely on new technologies? That's right. Take their hepatobiliary department as an example. For radical surgery of gallbladder cancer, if we can in these months make the new woodwork solid, our creation and review points, then you won't have to worry. There's no need to disband then. I remember this creative review. It is a points system. In the future, this industry will impact hospitals nationwide, ranked by points. The higher the ranking, the more resources you can get, the higher the level of attention. Until that day, even if you don't want to do it, leaders would take the initiative to come over. They beg us to continue new. The idea is good. New technologies. It's not that easy. It can be implemented. I also want to promote new woodworking techniques that they are today. Gallbladder cancer radical treatment would seemingly glamorous. In fact, it wasn't a private invitation. Experts from other areas came to help with the town's construction. This kind of thing. Can you fool the hospital leaders? Actually put on the table. Show it to the review experts. Full of vulnerabilities. Director. Number of level 4 surgeries. That's definitely not achievable. Not absolutely. There wasn't enough time. This kid is quite confident, but those surgeries not only lack time. Even at the level of woodworking, it may not even meet the standard. Some skills. Even industry leaders and experts, they have not yet broken through. I'm just a director at a municipal hospital. I know my own limitations. It's worlds apart from others. Actually, those surgical wells are not difficult. I can do it, and there will absolutely be no problem. But this kind of thing, we can't just look at the surgeon alone. Anesthesia for assistance is also crucial. You must keep up with the pace of the surgeon. Currently, I haven't been able to be with you yet. A good assistant, in case. Let's not consider it for now. Touch those complicated wooden hands. Director. Laparoscopic surgery. What do you think? Laparoscopy. So this is the way out you were talking about. In terms of the ability of new technologies to break through existing limitations, this surgery is indeed very suitable. But laparoscopy, the risk is just too great. If not done well, it will be more troublesome than a level 4 surgery. Jiang works in our line of work. It can't compare to other professions. Once we fail, there will be no way to recover. If it's for personal purposes to carry out, that would undoubtedly be risking the patient's life. Joke. Director. Technical wood is developing. We doctors, I just hope to help the patient get rid of the torment of illness as soon as possible. The risks you mentioned, I promise it won't happen. You guarantee? Can I really rest assured? Ultimately, you're just a newcomer. But why would there be such a powerful aura? It makes me feel like I'm standing in front of industry leaders. I can't even utter a rebuttal. People come. People come. Is there a doctor? Someone come here. Save my dad. Is there a doctor? Someone come here. Walk. Doctor. What's wrong? Doctors, please help my dad. He can't hold on much longer. This is. Director. It is an incisional hernia. Why is this hernia like this? This incision hernia is ridiculously large. That is the epidermis, still bound by wires. It's probably all broken inside. The only treatment is surgery. The technical complexity of this surgery, no less than level 4. Or should we perform open abdominal repair on the patient? The director is acting strangely. How? The patient was in excruciating pain. The degree of pain of a conventional incisional hernia, it shouldn't be that bad. Simply tie a belly band. But this patient's whole body was ice cold. I doubt it is an incisional hernia causing intestinal obstruction. What? Intestinal obstruction? Doctors, please think of a solution. The emergency room sent me to you. You said you could save my dad. The emergency room will let you come to us. Who told her that? Director Wang. Today's emergency room shift. It is Dr. Guan Liang. His diagnosis said the patient's condition was too acute. Fearing that not having enough time would affect the treatment, let me bring the patients. I've come here. Guan Liang, Department of Gastrointestinal Surgery. I knew Guan Liang was up to no good. When you encounter this kind of situation, cases in gastrointestinal surgery, I wish I could take over their entire department. Which one is it that gets sent to? Our general surgery department will treat the patient. Actively arrange for someone to bring the patient to your door. It is simply, I saw the patient's condition too tricky. They are afraid of taking risks, unwilling to accept. It's not easy to refuse directly. They're using our general surgery department as a shield. Sinister intentions. Director. They can be hands-off managers doing such a shameless thing. Our general surgery department, we must never be as heartless as them. I know. Take the patient to the emergency room first. Monitor vital signs at all times. Ensure that there are no errors. Hurry up and go. Ouch. That hurts. The patient's heart rate was 129 beats per minute. Respiratory rate 29 breaths/min. Oxygen saturation 91%. Blood pressure 80/45 mm of mercury. Nurse. What are the patient's blood test results? Is there an infection? Various test reports. Did you bring them all together? Cheng Bai asked. Guan Liang wanted to hurry up and finish. The patient shoved it over. Most basic check. No arrangements were made for the patients. They rushed over and brought the person over. Take the patient now. Go for a checkup. All blood related. Not one less. By the way, the patient will most likely need surgery. Get your blood type and cross-match done immediately. Priority will be given to sending them to the blood transfusion department. Good. Regardless of how others violate medical ethics, playing with patients' lives, I will never give up. After all, this is not just a vibrant life. It is also a rare opportunity. Xiao Jiang, are you sure you want to do this? This is an emergency situation. Laparoscopic surgery. Yes. Director. Too risky. Current laparoscopic technology. It was never perfect to begin with. Even if it's done at a provincial hospital, they will also give priority to choosing patients who are confident come. But our patient, even conventional laparotomy may not be successful. Not to mention, this risk is unpredictable. Laparoscopic surgery. Perhaps we should observe further. Surgery will be scheduled once the patient's condition stabilizes. The director couldn't wait any longer. It has already caused intestinal obstruction. If it worsens, it will cause symptoms. It's completely over. Director. Xing Xiaojiang. You should calm the patient down. Preparing for surgery. I went to communicate with their family members. Should I go and talk to the family? I was on duty today. I am the head of our department. Regardless of the outcome, I'll take responsibility. Take good care of the patient. Do a good job of pre-wood work. Leave the rest to me. You don't need to worry. Then wait a moment. What to do about the laparoscopic equipment needed? Don't worry. I'll handle it. You do the pre-wood work. I will notify you of the rest later. Good. Are you sick? I got off work late at night. It also disturbs people's rest. Who is it? Oh, Director Wang. Staying up late at night. What brings you here in the dead of night? Wang Jingkong actually wanted to take the equipment. That's the leader. I repeatedly told and instructed. Laparoscopic equipment. This old guy. What are you thinking about all day? Getting old. Just wait peacefully for retirement. What's the point of all this fuss? Besides, he himself was unaware. Why doesn't the leader allow the use of that equipment? Director Wang. I understand the situation. I just want to use this expensive instrument. My agreement alone doesn't count. It can only be done with the dean's approval. It's already past midnight. You need it so urgently. I need to take time to prepare. Do you want me to let you know? Since I became the section chief, no one has ever dared to treat me like this. Old geezer. How dare they hang up on me? Okay, we'll see. Are you in a hurry? I'll make you anxious to death. Hello, Dean Lin. I'm so sorry. I'm looking for you now. There's an urgent matter. Let me report to you. 1. This Lu Cheng. All he ever does is spout empty platitudes. He doesn't do anything reliable. Matters of life and death. He still dares to make me wait. Wait until he informs me. It's too late. What kind of bullshit regulations are these? I'll go to the equipment department now. Take the things back. Anyway, the general surgery department is going to be disbanded. I'm also at retirement age. I don't believe it. There's something even worse than this. What's going on? How much time has passed? Why aren't you coming back? Could it be that the patient sent there? It was pushed back to me again. Who's on duty in general surgery today? He seems to be a newcomer. To get caught up in this kind of thing today, he's just unlucky. So, has the person been sent over yet? Don't bother me with these kinds of troubles in the future. I can't be bothered with it. Why? Their people said you're overthinking it. As soon as we arrive there, they busy themselves around the patient. Arrange pre-timber inspection. Nobody has time to talk to me. That's why I've been dawdling until now. Oh, I see. Wait, say it again. They conducted a pre-logging inspection. Didn't you say that? The entire hospital. Only they can perform this surgery. I'm here. It felt pretty good just now. Now they've changed their minds again. You have to be careful when working with him in the future. This level. Incisional hernia and intestinal obstruction. Jiang Chenggang. That idiot. They actually arranged for the patient to be admitted. I went to have surgery. This is obvious. It's simply impossible to succeed. No! What if the surgery fails? The patient did not survive. The family insists it was me. Send them to the general surgery department. Isn't that enough? It's all over. It's all over. If other people find out about this, I am at the hospital. Then it would be impossible to make a living at all. I forgot to tell you, Director 1 of the Department of General Surgery was also present when I left. It seems like they said to do that for the patient. What was it again? Laparoscopic surgery. This is completely hopeless. If we say the big knife was successfully opened, it's a fantasy. So this laparoscopic surgery, it's simply treating the patient. They've been sent to the brink of death. We can't wait any longer. They must be stopped. At worst, we also need to talk to the family members and make things clear. We absolutely cannot do this. My rice bowl was smashed. Hey you, is it not finished yet? I asked several times and they all said it would be soon. As a result, I waited for a whole day. Why didn't you make it clear beforehand? It made us rush around in a panic, just waiting here. Excuse me, reporter. We'll send someone to check again. The main thing is this surgery. It's too difficult. It's an application of new technology no matter how you look at it. It will definitely take some time to conquer. Logically speaking, this surgery should not have been performed. It's been so long and they still can't get it. The people in the hepatobiliary surgery department, but they made a guarantee that it won't go wrong. That's why. Only then did they contact the media. They were asked to come and report. Yes. Who can argue with that? They were supposed to come out in the afternoon. As a result, it's been delayed until now. It's past midnight and it's still not over. Has something happened? Look at that person. In a panic. What's going on? What else could it be? Something must have happened inside. No way. Please don't. If we really fail, nobody's going to get a good night's sleep tonight. What's going on? Why are there so many people standing here? Even media reporters are. Rest. Guan Liang, you're not doing your shift properly. What are you doing here? Director Su, you're here. I just wanted to tell you something. Tell me quickly. Guan Liang, you definitely handled this wrong. Pay attention next time. Such a situation must not happen again. Guan Liang, how can you be so stupid? Jiang Chenggang is just a newcomer. Where did this skill come from? Perform surgery on the patient. Who gave him the guts? But the director. It's said that Wang Jingkong is here today too. I haven't figured it out yet. As long as Director Wang is here. Absolutely not. Left that Jiang Chenggang to arrange patient surgery. Since the last incident, Wang Jingkong became particularly cautious. Press card. Press card. This level of risk surgery, there's absolutely no way he would agree. In my opinion, they must be right now communicating with the patient's family. Have family members sign a consent form to waive surgery. The patient suffered in vain. Yes. How come I didn't think of that? A newcomer. How could he possibly have the ability? Yes. It's still that level of handmade wood. Hey, here it comes. This patient. The situation looks very serious. His whole body was covered in tubes. Press car. Press cut. In the middle of the night. It looks like I'll need to go to the emergency room for hand paralysis. Look, the patient's abdomen is ridiculously large. Could it be liver cancer? Does it cause ascites? It shouldn't be. If it's ascites, the patient only has a big belly. Other places must be extremely thin. Press search. But this person's weight is fine. He still has a feeding tube inserted. It's probably a gastrointestinal problem. Press. The patient needs emergency surgery. Irrelevant personnel. Please move aside immediately. Which department is this person from? Such a strong aura. Was he the main surgeon in this case? Too young. Director. Did you see it? This person is Jiang Chenggang. New general surgery. He has already taken the patient. He went in for surgery. You just said he didn't have the guts to do that. Shut up. What is Wang Jingkong thinking? Press. They actually agreed to let the newbie mess around. Who takes responsibility if something goes wrong? Director. The nurse said this surgery was performed by Wang Jingkong, not in approval. And what they are preparing to do is laparoscopic exploration. No big knife. What? Wang Jingkong still has the guts. Perform this type of surgery. He's really not afraid of patients having another accident. Fortunately, the previous accident, the momentum of general surgery, it's not that fierce anymore. Otherwise, the hepatobiliary department did this today. Radical gallbladder cancer surgery. It's estimated that it was already done long ago. They've got it all in the bag for general surgery. Director. That's Director Wang. M7. What device is he pushing? The screen is so big, like a television. Laparoscopic imaging system. Certificate. That's impossible. How did you end up here? Is it a new technology? M7. I guess so. Don't ask anymore. It's just a new piece of equipment. Strangeness. This device. It's been locked up in the yard for a long time. How did Director Wang produce it? You mean M7? The patient that the doctor just wheeled in. It's going to be a new surgery. Quick, Director Wang. Please. I must wake my father up. Don't worry. I assure you, we will definitely give it our all. Treat your father. Thank you. Director Wang, you wait here. We will notify you of any progress. Did I see wrong? I feel that Wang Jingkong today, it's a little different. Director, the patient is estimated to have already started surgery. What should we do now? Guan Liang, I advise you to think it through. Now is the best. Don't talk to the patient's family about this. Otherwise you'll easily get beaten up. Just pray. Hopefully this surgery will be successful. Otherwise, if a real problem arises, no one can cover it up. Oh, Director, do you think it will work? Who could have guessed that? Today's events have already affected us. They're all set up here. There's nothing I can do but pray. Oh dear, I deserve it. Why did they have to try and extort money from their general surgery department? I got caught up in it myself. What a tragedy. Who are you? I'm Jiang Chenggang, a general surgeon. Thank you all for your help today. This surgery, it is an emergency laparoscopic exploration. Director Wang will be there soon during the surgery to establish pneumoperitoneum for the patient. Please keep a close eye on it. Patient's ventilator parameters, arterial blood gas analysis, laparoscopy again. No wonder Director Wang. They specifically asked me to be there. So that's what it was about. The previous laparoscopic surgery accident. Everyone present was punished. Who would have thought? It's this kind of thing again today. So be it. Who's afraid of who? The equipment has arrived. Please make way. Oh, Xiao Lu, you're here pretty early. Hi Director Wang, it's you again. Jiang Chenggang. I specifically instructed the people in the operating room. Find the best in the whole hospital. Anesthesiologist came. The rest is up to us. Director, please rest assured. Rest assured. How can anyone feel at ease with this? If I remember correctly, this is only in the courtyard. This is my second laparoscopic surgery. The first time I messed it up to that extent. The two of them, they actually managed to have a conversation. Director Wang, the patient has recovered from anesthesia. Ready to have surgery. Thank you for your help. Brother Lu, we'll perform pneumoperitoneum on the patient later. Please bring the ventilator. Switch to pressure control mode. Try to increase the frequency as much as possible. Are you questioning my skills? You've misunderstood. Generally speaking, pneumoperitoneum is used for carbon dioxide gas. This gas is in the peritoneum. This will lead to increased carbon dioxide levels in the human body. This causes a temporary hypercapnia. However, pneumoperitoneum, it will dislodge the patient's abdominal cavity. A lot of pressure. The patient's diaphragm will also move upwards, compressing the lungs. This can easily lead to excessively high airway pressure. Therefore, under normal circumstances, adjusting ventilator parameters during anesthesia, choosing the pressure mode will make it safer. Effectively avoid the patient's lungs suffered barotrauma. And to talk about why increase breathing rate, it is to make the lungs faster gas exchange, remove excess carbon dioxide from the body, expel as soon as possible, relieve patients' symptoms of hypercapnia. Did I hear that right? He said. Anesthesia expertise. He is a surgeon. They know more than me. Today's surgery will definitely be successful. Jiang Chenggang, now that you say that, I understood immediately. This thorough explanation when I went to the provincial hospital for further training. I've never heard of it. That's amazing. Dr. Jiang, the patient's respiratory parameters. How do I set it up? Lu Tinker is in our courtyard. Key personnel in anesthesia. Professional knowledge and professional experience. In no way inferior to the director level. I really didn't expect that. He's so humble now. Seeking advice from Jiang Chenggang. This is not difficult. First, Refer to the patient's height and weight. Calculate the tidal volume based on lung protection, ventilation requirements. Adjust inspiratory pressure and positive breathing pressure. You can watch results of arterial blood gas analysis. Improve respiratory rate. So that's how it is. I understand. Zhao Jiang. The instrument is adjusted. Let's begin the surgery. Good director. Well, Chief Physician Jiang, you two are standing in the wrong places. Actually, you didn't get on the wrong platform. Positioning during laparoscopic surgery. Unlike traditional surgery. Oh, I'm sorry. I see. My first time participating in laparoscopic surgery. Not quite sure. Zhao Jiang. Look, director, let me help you adjust the mirror. I understand what the director means. However, given my current qualifications, not yet adjusted, he should not be the primary surgeon. Moreover, for laparoscopic surgery, the step of adjusting the mirror is also very important. Good. Then come on. This stupid access control is really in the way. Once today's surgery is over, I immediately went to find the hospital leaders. Adjust permissions. Even if the leader disagrees, I must let him. Authorization granted to Jiang Chenggang. Adjusted to level 4. Director. Preoperative disinfection preparation for patients. Completed. Good. Begin establishing pneumoperineum. This method is too primitive. However, considering the current level of technology, there's nothing surprising about it. What exactly is the director? People who have studied laparoscopic surgery, regardless of surgery, still drifting. Very professional, real. Although I have performed few laparoscopic surgeries. However, before, they also used substitutes privately. I've been practicing for a long time. Intraperitoneal injection. Director, I'll give it a try. Okay, it's quite easy to use. Jiang Cheng's knife strike was really cunning. This angle and depth, a slight misjudgment in striking the right balance. It was a medical malpractice case. The puncture was successfully completed. Prepare the ventilator for pressurization. Begin pneumoperineum. Brother Lu, prepare to draw arterial blood based on carbon dioxide levels. Blood gas analysis. Receive. Use your index and ring fingers, stuck at both ends of the puncture point. Tighten the skin. Position 1 cm from the center of the palmar transverse crease. 45 degrees. Insert half a centimeter. I understand. Blood recovered. Dr. Jiang, thank goodness you're here. OMG. Dr. Jiang, you are really amazing. Arteries. You might not be able to touch it even if you try. You just need to look. That will allow you to determine the correct location. It's almost like it came with a built-in machine. In vivo ultrasound. Operate. Diagnosis. The anesthesia is already top-notch. I never expected even vascular anatomy so accurate. Zhao Zhong's ability. It's so deep, it's unfathomable. There aren't that many unbelievable things. They're overthinking it. This is just an anatomical structure. And hemodynamics. It's just a projection on the skin's surface. If not sterile restriction. This level of puncture, that is like muscle memory. It was just a momentary reaction. Dr. Jiang, your judgment was very accurate. The patient does indeed have hypercapnia. Okay, that's fine. Brother Lu, if there are no problems, just use the original parameters. Switch to pressure control ventilation. Xing. I did it immediately. Why? Zhao Jiang. 5 holes need to be drilled. Need not. 3 holes are enough. Listen to you. Then drill 3 holes. This. I need to give it my all with the 5-hole method. He actually wants to reduce it to 3 holes. This effortless control. Truly amazing. Look at his calm and composed demeanor. In addition to the previous effortless operation, today's surgery, he's probably far from reaching his limit. At this age, such abilities. It's impossible not to admit you're getting old. Director, the observation and operation holes have been completed. You can take off the mirror now. Good. After he did that, this surgery, it looks pretty simple. The view is really clear. So that's how laparoscopy is done. That's amazing. The latency and noise are terrible. Director, I observed severe intestinal wall adhesions in the patient. However, the intestinal tract is reddish. Good blood supply. No need for excision. Adhesion release surgery can be performed. No problem. Good. Director, pay attention to the upper margin of the mesentery. Inflammatory edema. Free time. Avoid the arterial and venous communication branches below. Okay, director. Now we will proceed with small intestine separation. Reduce the range of motion a little. Blunt peeling. Avoid shearing force from the tips of the pliers. Scratching the intestinal wall. Cause perforation. Okay, who exactly is the surgeon? Who is the first assistant? Dr. Jiang is incredibly capable. We haven't figured out the current structure at all. He already anticipating the next risk point. There's no need to confirm repeatedly. No need to even look back. That's right. With Dr. Jiang in charge, I feel particularly confident. This feeling was unprecedented. I hardly need to consider where to go next. The camera was adjusted in advance. The perfect angle. Like a peerless master. Hold my hand and guide me. Complete every exquisite movement. It was so smooth and flowing. Director, the surgery is over. What's so fast? Is that all? Director, there's another thing. What's wrong? There are still steps to be completed. It's over. This surgery made me feel like I was facing a formidable enemy. That's how it ended. The patient's life was saved. The obstruction was also cured. I should be happy. But this inexplicable feeling of emptiness. What happened? It seems like they still haven't had enough. Director, the crisis of intestinal obstruction has been resolved. The anesthesia is still effective. Look, or we can just grab that. Repair the incisional hernia. Alright. Focus on treating patients' emergencies. I forgot about that. Repairing such a large incisional hernia. The difficulty level is even higher than before. Even in normal times, I have to be on my guard. I just had laparoscopic surgery. My condition has deteriorated significantly. Moreover, laparoscopic instruments. This means losing tactile feedback. Even with Jiang Chenggang here to oversee things, my hands, I'm afraid they might not be able to handle it. Why? Director Wang. Hernia repair. It's a level 2 surgery. That's right. This type of secondary surgery, with Dr. Zhang's current authorization, it is capable of performing surgery independently. Xiao Jiang, you wouldn't have started from the beginning, would you? You've already thought of this step, haven't you? I see. Lai Xiaojiang, you will be the surgeon. I'll adjust the mirror for you. This is backwards. Dr. Jiang performed the surgery. Director Wang adjusts the mirror. If I remember correctly, the entire hospital is capable of performing laparoscopic surgery. It was only Director Wang. Right, Dr. Jiang. Is it really possible? Director Wang. Adjust the camera position. Oh, that's strange. My hand is very steady. How could the camera be off-center when it hasn't moved at all? Preparing to free the hernia sac. The director kept his eyes fixed. I see. Why is it that even though I didn't move, but the mirror is at the wrong angle? It was Jiang Chenggang's action. It was too fast. At first I could barely keep up, but ever since I met that, after a large hernia sac, Jiang Chenggang's splitting shears, the spinning speed is as fast as thunder. If I'm not mistaken, after images appeared unexpected. Just keep up with his pace. That's how much physical strength I've used up. This old man. End of freeing. Preparing the contents of the hernia. Return to abdominal cavity. Why, director? Are you alright? Director? Holding a mirror is indeed very tiring. Do you want to take a rest below? Take a break? Don't you know the truth? This operating speed. Who can handle that? Don't worry about me. You continue. Good. It's almost over. Has he slowed down? Was he considering my physical strength, my old bones? Never mind. It doesn't matter. Our general surgery. There is hope. Director Wang. Operation. Is it almost over? Preparing for follow-up work. Really efficient. Preparing EPTFE patches during tours. Brother Lu expects it to end in 5 minutes. Please adjust the anesthetic dosage. Dr. Jiang. The PTFE patch you mentioned. What is it? Expanded polytetrafluoroethylene patch. We don't have it here. Xiao Jiang. The hospital currently only has polypropylene patches. The one you mentioned. It's something new. We haven't introduced it here. Okay, I almost forgot it's the 1990s. Then let's use polypropylene. Warm saline flushing of the abdominal cavity. Negative pressure suction. Final review. Is there active bleeding? Dr. Jiang, your skills are simply amazing. The repair marks. The patient has never had it before. Incisional hernia. This is not a regular surgery. This is the first case in our hospital. Laparoscopic combined surgery. Such a perfect case. It should be written into the history of the institute. I was worried before. After the general surgery department was disbanded, Jiang Cheng just arrived at another place. People will look down on you. Who knew? He was skilled with a broadsword. Theory, experience, operate. Each one is a strength. Now, he withstood the pressure when the patient's life was in danger. This machine is complete. A surgery that is almost impossible to succeed. Laparoscopic exploration. Intestinal adhesion release. Hernia sac reduction. Incisional hernia repair. Completed in one go. A landmark demonstration. Xiao Jiang. If I'm not mistaken, at tomorrow's dean's meeting, general surgery, the 3 characters he Jiang Chenggang. It's destined to stir up a storm. His ability and courage. And this composure under pressure. From top to bottom of the entire hospital. Even someone might not be able to compare. What exactly is going on? This radical gallbladder cancer surgery. Didn't we agree to wrap things up in the afternoon? What time is it? Why isn't it done yet? Lie. The director is angry about this. What's going on next door? How can surgery be performed when the argument is going on like this? The plans were completely disrupted. Mingming's last checkup. The tumor is still confined to the gallbladder. Now it has spread on a large scale. Not just the gallbladder. Even places like the lymph nodes and liver. Without exception, they were all infected with the lesion. If it weren't for the severity of the disease, the surgery ended early. Fortunately, the patient's pancreas. No infection has been detected yet. Otherwise, based on my clinical experience, it's simply impossible to complete this pancreatic duodenectomy. Director Song. It's the general surgery department. I heard that an emergency surgery was just completed. The surgery is now complete. The patient was removed from the stage. Emergency in general surgery. What difficulties could they possibly face? It'll probably just be an appendectomy. Uncultured. That's really pitiful. Patients above the gallbladder. They all fall under the jurisdiction of our hepatobiliary surgery department. Even the simplest hernia repair. They were all assigned to the gastrointestinal surgery department. Not to mention intestinal obstruction, left hemicolectomy, partial gastrectomy. This complex surgery, they are general surgery. That Wang Jingkong. Who can handle the rest? Once their vascular and proctology department is established, it's obvious without even thinking. After that, I'm afraid even hemorrhoids need to be removed. General surgery had no say in the matter. The general surgery team. You're this happy about having a level 2 surgery? They probably haven't seen anything like us before. Level 4 surgery. If they were to do it, if it succeeds, it seems like they're about to start making a big fuss. A group of frogs at the bottom of a well. Oh Jiang, I haven't figured it out yet. The ship of general surgery is sinking. If you don't jump ship, you regret it later and won't even have a place to cry. Why? I understand better than anyone else. Although there were no outsiders among them thinking so unbearably, it's not far from going bankrupt. Sigh. There's no way to refute it. The entire department is now in a state of panic. They are all finding their own way to make a living. Besides the director, who still has the mind to focus on surgery. I'm not old. The technology is still there. No longer thinking about themselves. But then it would really be too late. Maybe. Now leaving general surgery. It is indeed the best choice. Director Song. I just went to the general surgery department to deliver something. What they did. It doesn't seem to be an appendectomy. So what are they doing? If I'm not mistaken, the patient report stated incisional hernia plus intestinal obstruction. Surgeon Wang Jingkong. If he does it, it's acceptable. They are general surgeons. Only he was left. They can hold their own. Well, that old fellow Wang Jingkong. The technical indicators have dropped way too drastically. A hernia repair plus intestinal obstruction. It can make the people under your command so happy. The people in the courtyard found out. I bet they'll laugh themselves to death. No. Director Song. I remember seeing this just now. A young doctor I've never met before. Besides, the surgical procedure next door was quite novel. No major surgery was performed on the patient. That person took a device like a long pole, performing procedures while watching the screen inside the patient's abdomen. Could it be laparoscopic surgery? Let a young doctor perform the surgery. Is Wang Jingkong getting senile? Director. The wound is about to burst open. What's going on? Goss. Can you do it? Who are you trying to fool with this stitching? Redo. You typed it yourself. Wang Jingkong ate bear's heart and leopard's gall. Daring at such a crucial point. Laparoscopic surgery. What makes him so special? Treating patients like children. Pure nonsense. Could I have misread it? How could laparoscopic surgery be performed? Moreover, it was done laparoscopic. Incisional hernia repair. Add intestinal adhesion release. How high a level do you want to achieve? Director Wang himself. I'm afraid we won't be able to win any of them. Didn't you hear what the nurse said? It wasn't Wang Jingkong who did it. The surgeon was a young doctor I didn't know. Listen to this noise. It seems the surgery was successful. I don't believe it. Who has heard about that new doctor can perform this surgery? The directors of this department. Even they might not be able to do it. Words are no proof. Go take a look. Become. I'm so curious about laparoscopy. Director Song disagreed with something. He throws things and curses. If it weren't for the fact that I had to learn from him, I can't be bothered to live my life constantly having to put up with his attitude. Director. Even if general surgery gets lucky, what if you succeed by luck? It's basically just patching. Send a sausage, a flower stand, attention seeking. If they're so capable, they should try general surgery. Perform a level 4 surgery using laparoscopy. Guaranteed to expose him on the spot. Even that might not guarantee the patient's safe exit from the operating room. Dr. Zheng makes a good point. Laparoscopy is indeed a new technology. It's only suitable for minor surgeries. At best, he'll be a supporting role, trying to simulate a human hand with 2 iron rods. Perform complex operations. It's a complete fantasy. Take appendectomy as an example. Director. Please take action. It will be over in half an hour. It can also guarantee the patient. He got out of bed and moved around the next day. He fully recovered and was discharged from the hospital in less than a week. This level. Can it be done with a laparoscopy? Old Jiang. Don't hide it from me. The young doctor who performed the surgery next door. Could it be Wang Jingkong? Hide from outside privately. Experts in this field. Right? Jing Wu, you need to calm down for a bit. What is the current situation in the general surgery department? Everyone knows it. Director Wang was so worried. I can't sleep. How could there be time? Why don't you invite some big shot to oversee things? Not hide from outside. Who else could it be? I know almost everyone in the general surgery department besides Wang Jingkong. Who else has this ability? Could it be Jiang Chenggang? Impossible. What am I thinking? How old is Jiang Chenggang? Just a kid. Mastering open abdominal surgery. That's already amazing. That's already the absolute maximum. But laparoscopy is something like that. Anyone with less than 10 years of clinical experience. Oh wait, that's not right. So, Jiang Chenggang, could it be from last time? I'll go with you to take the patient home. Hot hit? Ha! Hey, old Jiang. Oh, old Jiang. I think you're confused too. Big shot and good for nothing. I can't tell them apart anymore. Dr. Jiang, if you have no problems with this order, I need to sign. Dr. Jiang, items used during surgery. Everything has been inventoried. Please take a look. Dr. Jiang, special material usage record you requested. I put it here. You might take a look when you have time. Use mine. Dr. Jiang, write it on my back to avoid accidentally tearing the order form. Dr. Jiang, unexpected. You're so amazing on stage. So shy after stepping off the stage. Awesome man. It is important to be firm on both ends. One end is technology. The other one, you'll only know if you try. What are they doing? I've been a doctor for so many years. I've never received this kind of treatment before. Jiang Chenggang is just a new employee who has only been here for 2 months. Why should everyone revolve around him in the time it takes to perform an operation? These people became completely familiar with each other. Dr. Jiang, pushcart. Leave the low-skill tasks to us. Your hands are for saving lives. Dr. Jiang, I still need to communicate with the family members later. The patient's vital signs have stabilized. Dr. Jiang, I'll take care of it. You should talk to Director Wang first. Go and share the good news with the family. Estimate them. I'm so anxious. Uncle, don't worry. In the future, no more stomach aches. Hey grandpa, uncle, don't move. The tube in my throat was just removed. There is also local bruising and swelling. We'll talk about it after I recover. If nothing else, I'll go first. Brother Lu, I'm entrusting the patient to you. The director and I will be here shortly. We're like brothers, aren't we? We'll have another chance to team up in the future. As long as you believe me, the work assigned to me, absolutely foolproof. Don't worry. Land. Brother Lu Tinker is a hospital. The earliest batch of anesthesiologists. I saw him. Everyone must respectfully call him Teacher Lu. He actually called him Brother Lu. Moreover, Lu Ting wasn't angry at all, so happy to accept. What exactly happened during this surgery? It can make the whole operating room. Everyone admires Jiang Chenggang so much. Gone. Walk. Yo, teacher Jiang. So dedicated. Are you not finished yet and going back without? Sigh. Old Jiang, you tell me the truth. This kid's surnamed Jiang. What exactly is going on? Ouch. I don't know either. He hadn't been there long. Normally I just work a shift. Today, Director Wang specifically instructed. Otherwise, how would he have gotten the chance to take the stage? He'll only ever be a lackey, no matter what. 2 surgeries. Moreover, one of them, Director Wang, laparoscopic surgery with utmost caution. What kind of spell did this kid cast on the director? The director was so indulgent towards him. Maybe the big shot he invited was in charge of the project. If I remember correctly, Jiang Chenggang graduated from the Provincial Medical University, right? Maybe he really does have some connections. No wonder this kid dares to be so arrogant. So that's why they have such powerful connections. Dean Lin and Section Chief Lu. Why are they here? They came to the operating room. Is the Dean come to support new technologies in hepatobiliary surgery? It shouldn't be. Dean holds a high position. Never cared about specific business. It's impossible because of a surgery. I was there in person late at night. Guan Liang. Look at the mess you've made. Even the Dean was alarmed. Let's see how you handle this. I heard there's a show tonight. Emergency surgery performed laparoscopic. Why? Dean Lin is indeed coming for laparoscopy. Director Wang was too reckless. Laparoscopic equipment. However, the Dean ordered it to be sealed. Things that are not allowed to be moved. They even dared to use it on patients in the operating room. That is, he wasn't afraid of something happening. In case of getting into a lawsuit, even a dignified retirement is no longer possible. Has Wang Jingkong gone mad? At such an advanced age, he still dares to do these things. Can't we just honestly wait for retirement? General surgery department disbanded. It's all a done deal. All that's left is to sign and issue the notice. Why do they have to cause trouble at crucial moments? Nonsense. This director's job is too leisurely. Because of a little bit of empty fame, they don't care about the rules anymore. Dean Lin, this isn't the first time Wang Jingkong has done this. Relying on seniority. Lawless. He's slapping you in the face. I told him to follow the procedure and wait for notification, but he wouldn't listen at all. He hung up the phone right away. They even forcibly pushed away the equipment. We really couldn't stop them. Dean, you must do this for us. Uphold justice. Protect. This is absolutely ridiculous. Dean Lin, it's not too late for us to go in and stop it. As long as the equipment hasn't been used. They were ordered to stop immediately. The province caused serious consequences. It affected the entire hospital. Okay, that's not right. Dean Lin, they actually came now. If it was because of that liver and gallbladder surgery, he wouldn't have waited until now to show up. Could it be his goal was actually the laparoscopic surgery inside? Who are Lu Qiongjuan's family members? Oh, so many people. Are you a relative of Lu Qiongjuan? The surgery is over. Come on. Yes. Here, I'm a family member of Lu Qiongjuan. Doctor, don't scare me. Don't scare me. Is my dad doing alright? Don't worry. The surgery went very smoothly. Thanks, child. Dad is alright. Everything is fine. Dad, child. It's all in the past. Dad feels especially relaxed now. Don't worry, Grandpa. It won't hurt anymore. Go back and spend some quality time with your family. Enjoying family life. Why? Get up. Get up. This is all part of our duties as doctors. You don't need to do that. No, you don't know. I really can't think of anything. How else can I thank you? If it weren't for you, today, Ken will help my father with the surgery. My father? He might really be, to be honest, my father's problem. I've been to many hospitals for checkups. Everyone says he is currently unable to undergo surgery. The success rate is almost zero. Thanks to you, you saved his life. Worth it. My previous understanding of laparoscopic surgery have such high hopes. This has led to a lot of criticism, even if condemned by thousands. As long as the patient's life can be saved, save their entire family, it was all worth it. Fast cut. Keep up. Give a close-up. The key is the expressions of the family members. This is a rare sight indeed. And the doctor's reaction. Don't miss a single one. I took a picture. Perfect angle. Press card. Must buy a strip. New laparoscopic technologies. Igniting hope for patients' lives. Family members knelt in gratitude. Interpreting the great love of doctors. This is how you write a news outline. Today was originally intended to. Which hepatobiliary surgery is coming? As a result, it's been delayed until now. No news yet. Considering the nurse's repeated attempts to persuade me to stay. That's why I patiently stayed. I only managed to hold on until the word patients didn't come. That's why I patiently stayed. Press card. Rest card. Press card. Luckily, I stayed. Or else, we miss out on such excellent material. Hello, I'm Liang Chongjun, a reporter from the municipal radio and television station. I came here at the invitation of the hospital. Interview with our hospital. Application of new laparoscopic technologies. Excuse me, what exactly happened when the patient was admitted to the hospital? Rest card. That's why you're in general surgery. Final choice. Laparoscopic surgical plan. Rest card. Completion. That's not how the script was written. We agreed to do an interview. Radical cholecystectomy in hepatobiliary surgery. Why did the reporter change their mind at the last minute? They set their sights on their general surgery department. Laparoscopic surgery. It's all over. It's all over. This is complete chaos. Press card. Press card. I remember the resources of this TV station. It was Director Song who put in a lot of effort. I was turned away quite a few times. That's what we just secured for the hepatobiliary surgery department. The purpose is to promote their new technology. Now it's actually fallen on our side. The general surgeons hate. Director, answer the reporter quickly. Our general surgery department. Laparoscopic techniques. It should be known by everyone. After tonight's battle, laparoscopy, no longer what they call crooked ways. Rather, they are real weapons that can save lives. This is a rare opportunity. Once this opportunity is gone, it's gone forever. What else is there to worry about? Hello, Reporter Leong. I'm from our hospital. Director of General Surgery, Wang Jingkong. The decision to adopt this surgical approach is such a complicated condition. I don't even dare to have my abdomen open. But their general surgery department not only did, they also used the new laparoscopic technique. And it was a success. And this surgery was absolutely perfect. Wang Liang, you'll be off work tomorrow. Come to my office immediately. Come with me to the general surgery department. See Director Wang in person. Apologize. Director, what do you mean by this? The patient has recovered and there are no problems. Besides, they are general surgery. Isn't the group about to disband? How do you know? The Department of General Surgery will definitely be disbanded. A formal notice has been issued. The Dean told you himself. Just wait and see. After today's incident, dissolution of the General Surgery Department. It's probably not that simple. Walk. Director Wang, as the chief surgeon of this operation, when you perform high difficulty operations, do you feel stressed? Reporter Liang, if you ask me if I feel any pressure, I will definitely answer you. Feeling pressure is inevitable. But if your question is the surgeon who performed this operation, I think only those around me. Dr. Jiang Chenggang is the only one qualified to answer. You mean the surgeon who performed today's operation? It is Jiang Chenggang. That's right. He looks way too young. Director Wang even claimed that he was the surgeon. That's just talking nonsense. The audience isn't stupid. Who would believe that? Oh, I understand. Press card. Press card. This Wang Jingkong. This is a note from Jingkong. On the surface, he appears to be a gentleman. On the surface, he appears to be a gentleman with a C-level certificate and a press CA. In reality, he probably schemed quite a bit behind the scenes. His operation, isn't it just a way to push their own people onto the camera? He must have a mastermind behind him. Such a young doctor. How capable can he be? Looks like I'll have to come again tomorrow. Follow and film carefully. Director Wang's daily work routine card. Reporter Liang. The patient's 4 fluids were almost finished. It's getting late. We need to take the patient to rest. That concludes today's interview. Oh, okay. The young doctors I've encountered before. Which one didn't seize the opportunity? Trying his best to perform in front of the camera. Rest card. Self-proof. Jiang Cheng just happened to be plain and ordinary. They sent us away with just a few words. This guy is quite interesting. That concludes today's interview. Reporter Liang. Self-proof. Look, Dean Lin is still over there. Why don't you interview him again? Gather all the materials. In case the hospital office in a few days, we'll ask you to do a reshoot. Depend on. Press card. They actually took the hospital. The top leader forgot. Press card. Has card. Dr. Jiang. Unexpected. You seem to know so much about the interview process. Press card. Press card. Reshooting footage. Minato materials. Insider talk from media professionals. He actually knew. Isn't Jiang Chenggang a doctor? Could it be that you have relatives or friends also working in the media industry? There is a foundation in the medical system. Some people are praising. It also relates to media publicity. This strength and background. It is estimated that Jiang Chenggang soon to become a part of the medical industry. Top tier players. Press card. This is our hospital's Dean Lin. He came so late just to supervising the implementation of laparoscopic techniques. Ensure that nothing goes wrong. Do everything possible to protect the patient's life. Dean Lin. Thank you. Thank you. He personally rushed over in the middle of the night. My dad can receive treatment at our hospital. This is truly a blessing our whole family has earned. Oh, you're exaggerating. This is what we should do. Saving lives is a doctor's duty. Wait until. How do I remember? I rushed over in a panic. It's to demand an explanation. I shouldn't be now. Is it troublesome to go to the general surgery department? That's right. Successful trial of laparoscopic technology. It requires the concerted efforts of the entire hospital. I initially allowed general surgery. The original intention of performing this surgery, I just want the patient to receive more effective treatment. General surgery today. They fought a brilliant and tough battle. The results are obvious to all. Full praise is due. However, the patient, having just undergone high-intensity surgery, needs rest. I'll go to the general surgery department again tomorrow, visiting everyone. Didn't the dean just say general surgery is flawless? Does it need cleaning up? How did it suddenly become a commendation ceremony? Jiang Chenggang is such a cunning guy. I don't want to do things that involve currying favor with the boss. Let me, an old man nearing retirement, bump it up. Never mind. For general surgery, Dean Lin. Thank you for the support and encouragement from the hospital leaders. Our entire general surgery team. In the future, we will definitely work under your leadership. Continuously learn from experience. Uphold innovation to better serve the people. Okay, I feel relief with Director Wang around. Wang Jingkong, that stubborn old man. How did you learn this trick too? Director Wang's words make sense. One must be strong to forge iron, regardless of technology. Or is there a need in the equipment? Come directly to my office. We guarantee to provide full support. Our general surgery department carries out its work. Section Chief Lu, did you remember what I said? Future equipment needs for general surgery. You must coordinate immediately. We absolutely cannot delay the progress. Did you hear me clearly? Okay. Okay, this is your attitude towards something I personally instructed you to do. Wasn't I clear enough? Dean Lin, I'm sorry. I promise I will not delay your progress. What do you mean by slowing down my progress? It cannot be delayed. The overall framework for hospital development. Yes. What's wrong with Lu Chen today? At this point, not even a flattery. They can't even film it clearly anymore. Come, be careful. Teacher Jiang. Hepatobiliary surgery. How well did you do? Let's go back together. I'll head over now. Why? If only we could follow the director's instructions from the beginning. I will continue to learn from Jiang Chenggang. Today's historic surgery. I can also get some credit for this. Old Jiang. What's wrong? He was dumbfounded after being outmaneuvered by the young man. Well, no, by the way, walk. This makes me want to give up. A dilapidated department on the verge of disbanding. Who is worthy of us? The booming hepatobiliary surgery. Comparable. Don't let temporary setbacks cloud your judgment. They just stumbled upon it by sheer luck. If it were a proper level 4 surgery, guaranteed to expose your true colors on the spot. Why? Hey, you, Jiang Chenggang, you're asking for trouble, aren't you? I don't believe it if it works. Now that the wall is falling, everyone is pushing it down. Your general surgery department still able to survive when the group completely breaks up, begging me to take them in. It's not your turn anymore. Dear reporters, what about today? That's all. Thank you. Hey, Dean Lin, you can't leave. Dean Lin, I'm Jiang Wu from the Department of Hepatobiliary Surgery. Our department director Song Pengtion. Radical cholecystectomy performed by the surgeon. It's almost over. Director Song of Hepatobiliary Surgery. I heard they were transferred from another hospital, right? Good talent. Keep it up. Thank you for the dean's recognition. By the way, who are you? Oh, my name is Jiang Wu. Oh, okay, I'm leaving now. You can continue with your work. Oh, oops. Knock off. Finally done. Finally got it done. Let's hurry back and edit the video. Urgent request required. The manuscript and video will be completed within the month. Let the station review it. Hey Liang reporter. They left. People with liver and gallbladder. It hasn't come out yet. Why stay after the interview? You people didn't come out. What does this have to do with me? I love reporter Liang. Please have mercy. Please give me some face. Let's wait a bit before we leave. The liver and gallbladder surgery is almost over. You used the same excuse during the day. It's already several hours late. They still made us wait. I would like to ask a question. The immediately you're talking about, is it measured in hours? You do not say. CAKD. Press card. We waited for several hours. Not a single word of explanation. In the end, they still wouldn't let us leave. We still have to wait. What's the difference between this and playing with people? Card. Press card. Reporter Liang. All the mistakes we made were our fault. But this interview, it's really crucial for us. What do you mean? And what was the result? There was still no news by evening. Your time is precious. We can then waste our time at will. I don't care. You agreed anyway. Working in the media. We can't go back on our word. Can we? Good. You insist that I wait, right? Then give me a straight answer. What exactly was this surgery? How much longer until it ends? Minutes or hours? Walk. Oh dear. Don't go. Wait a little longer. It's finally over. It's all the fault of the general surgery department next door. The laughter and joking affected my gameplay. Otherwise it would have ended long ago. Why did it drag on until now? The area outside must be packed with people by now. It must be bustling with noise. Applause to congratulate Chi Fei. The family was moved to tears. City radio reporters were also on high alert. At least this relationship. It was something I went to great lengths to get. How can you succeed without a little emphasis? Reckless. Were you terrified by the scene outside? What kind of applause? And I'm doing an interview too. How come they're all gone? I'm still here. Where are they? Director, are you done already? What is Jiang Wu's current situation? Why is there no one here? Could there be an emergency in the hospital? Director, please let me explain. Mainly their general surgery department. Out of nowhere. Dean Lin and you, the reporter I painstakingly found. They snatched them all. The others are getting impatient waiting for us. They left together. That's impossible. Because of this, everyone left. Attention-grabbing laparoscopic surgery. Why does he steal the spotlight? My surgery was a level 4 surgery. Do they even know what a level 4 exam is? More than 10 hours. There wasn't a single person there. Are these people out of their minds? Can't you tell which one has higher gold content? Director, the color in the patient's drainage bag. Something's not quite right. What's wrong? Isn't this normal right after surgery? Making a fuss. Good. Okay, you should take the patient home first. Arrange for nurses to monitor patients' vital signs throughout the day. Contact me anytime if there's a problem. Go. Good. Director, is Dr. Jiang there? Morning meeting started. Director Wang has something to announce. Here. Is everyone here? Today I will announce two main things. First, general surgery. Effective immediately. Laparoscopic surgery is routinely performed. Person in charge of this work, Dr. Jiang. Did you all hear me clearly? Really? The department needs to perform laparoscopic surgery. Jiang Chenggang is in full charge. What's wrong with the director today? Why was it announced so suddenly? Laparoscopic surgery has been performed. Isn't our department going to be disbanded? The second thing, starting today, Jiang Chenggang officially promoted to Chief Resident of General Surgery. Everything, regardless of size. He listens to me as long as I'm not around. Did I hear that right? How could it have happened in just one night? The department underwent a complete transformation. Yes, good. That's exactly the effect I wanted. The reason I am here today, Jiang Chenggang's appointment should be announced publicly. It was to establish Xiao Zhong's authority. Make it easier for him to work. Just give it a tap. These lazy bums. More importantly, I must make them understand. The Department of General Surgery will not be disbanded. It must rise from the ashes. Jiang Chenggang, don't just stand there. Let me say a few words to everyone. Director, I'm still relatively inexperienced. I will need to learn more from everyone in the future. Let's not talk. Good. Today's ward rounds will be led by Jiang. I have to go out for a while. You guys go ahead and get busy. Today is our General Jiang's turn. First time leading a ward round. Be more energetic. That's right. Dr. Jiang is young and promising. We can't hold them back. Please stop joking with me. Everyone, I'm the youngest in the department. Please just call me Jiang. It sounds more friendly. Dr. Jiang is too modest. Let's go then. The one leading the team is. Which department's doctor is it? So young. Is he the director? Why, he was just last night. Is it Dr. Jiang who is on night shift? I remember him coming to the hospital not long ago. They can bring so many people to make ward rounds now. Haven't you heard? I heard last night. The patient's family said, even if Director Wang has questions he's unsure about, we should consult Dr. Jiang. They even said that if it weren't for Dr. Jiang, her father was in danger. It can't be a lie. Right, so amazing. Bed 1 is for a new occupant. Postoperative patients with colon cancer. 1 month post-surgery. Left colonnade immunization. This patient was admitted to the hospital for treatment due to general malaise. Completion. Just arrived. And then I encountered such a difficult patient. I also feel unwell all over. That's too broad a statement. Let me take a look. Okay, I understand. Are you not going to continue describing the patient's condition? Has the old man had breakfast? Oh, you asked about that? I only ate a little bit. Besides gastrointestinal discomfort, do you still feel energetic all over? Frequent hiccups. The amount of discharge from the ventilator is also greater than before. Amazing. How did you know? I just arrived this morning. I haven't explained it to the doctor in detail yet. It's very simple. You can see it with your eyes. You feel weak all over. Gastrointestinal discomfort. The cause is colostomy. Cause fluid loss. This leads to water and sodium retention. But you see yourself swollen. Mistakenly thought it was from eating or drinking too much. So during this period, self-restriction of food and water. Unexpectedly, the symptoms worsen. I had no choice but to come to the hospital. Doctor, you're a god, right? You must be an all-powerful deity. Or my illness over the past 2 weeks. You've hit the nail on the head. Uncle, your current situation. It is acute kidney injury. No, acute kidney injury. The patient has been feeling unwell recently. It was caused by kidney disease. This doesn't make sense. The patient was clearly post-colon cancer surgery. Even if there is complications, it's probably a gastrointestinal problem. When did it come down to kidneys? Doctor, did you make a mistake? My kidneys have always been very healthy. Can eat and drink. There can't be anything wrong with it. If you don't believe me. Why? OMG. The patient's foot is so swollen, like steamed buns. The patient's foot is so swollen, like steamed buns. When I arrived this morning, it's not that swollen yet. How much time has it taken? How did it come to this? It seems the kidneys in bed 1 are really damaged. I just had doubts. Did Dr. Jiang make a mistake? Who would have thought that others? The root cause was found immediately. I finally understand why. Director Wang should be promoted exceptionally. Jiang Cheng has just become the chief resident. Director Wang must have known all along. Dr. Jiang's skills are amazing. That's why I persisted. Patient's renal function indicators. In the acute phase of exhaustion. Doctor, immortal. You can see through my illness. There must be a way to save me, right? If blood filtration could be done. Assess the patient's condition. It should stabilize in 3 to 5 days. Blood filtration. We can't do this. We need to go to the provincial capital. Even in provincial capitals, there might not be blood filtration machines available. I can cure your illness. Can it cure real or fake? Dr. Jiang, this patient's condition is complex. After colon cancer surgery, there is also a source of infection. In addition to acute kidney injury, his serum creatinine level was significantly higher than normal. 6 times the normal value. What else can be done to treat this? It doesn't matter. Precision fluid replacement. Just clear the blockage in the glomeruli. What? The patient's edema is so severe. Replenish fluids as needed. My body can't take it. What if it triggers acute heart failure? According to this plan, take the patient for a blood test 4 hours later. Follow up liver and kidney function tests. I believe creatinine levels can be reduced to below 300. No rush for what follows. Gradually rely on medication for treatment. Don't worry, everyone. Dr. Jiang, I can understand the first point, but this second point you wrote, I really don't understand. This is the formula of third-generation oral rehydration salts, able to achieve fluid replacement, dual effect of stopping diarrhea. Not only can it shorten the course of diarrhea, more effective in preventing and treating prerenal kidney injury by expanding blood volume, reduce the harm of edema. This third-generation ORS rehydration salt, it should have become universal after 2002. However, the patient's condition is currently urgent. I can't worry about that anymore. Uncle, don't worry. You were consuming too little food the other day. Too much loss. This leads to indeterminate renal perfusion. Decreased filtration function. This led to edema and kidney damage. Subsequent treatment. As long as fluid replacement is precise, reactivate kidney function. It'll be fine. Thank you, Dr. Jiang. If it weren't for your ward rounds today, my old life is probably over. Oh, it's okay. These kidneys are just sitting around unused. It can also lead to big problems. Grandpa, please get some rest. Early recovery. Let's go. Oops. It's still too late. None of the footage of the general surgery morning meeting was captured. Hey, Lou, it looks like we'll have to do another take later. Why? Good. Just in time for the general surgery ward rounds. What an impressive scene. Take more pictures. It will definitely come in handy for post-production editing. Are you sick? Don't you watch where you're going? Hitting me is a small matter. If you damage the machine, you'll have to pay for it. Why does this person seem so murderous? What situation? What kind of quality does this person have? Something extremely important. You can't do it in the ward either. I'll go call security to handle this. 5 Bates. Is it the pregnant woman from yesterday? What pregnant woman? A pregnant woman came yesterday. She came with a man. I arranged for the man to sign informed consent. He was unwilling. They said they were not the patient's family members. There's nothing I can do but give the emergency contact person on the medical record. I made a phone call. I also felt sorry for that pregnant woman. That's why I made the call on my own initiative. The man who answered the phone. I was confused at first. After clarifying the situation, he hung up without saying anything. What should I do? Dr. Jiang, I'll go take a look. You follow the procedures. No difference. I'll handle it. While I was away on a business trip. You're talking nonsense. Comrade, calm down first. Why? What are you doing? I'm the head of the department. Speak slowly. How can I calm down? I'm just going on a business trip. She was about to give birth and still had affairs with men. This kind of thing gets out. How can our family ever hold our heads high again? Comrade, listen to me. This is all a misunderstanding. Misunderstanding my ass. In the middle of the night, my wife was hospitalized after being taken advantage of by another man. How could I not be angry? What should I do? The family members simply won't listen to any explanations. When you encounter this kind of thing, which man could stay calm? It's a miracle they didn't break down on the spot. If it were me, I would have gone crazy by now. I simply can't listen to people calmly. What are you doing? Don't do anything reckless. If we don't make things clear today, she can forget about leaving this room. Comrade, be rational. This is the general surgery department. It's a place that makes handmade wood. It's not what you think of as gynecology. Your spouse is in the hospital today. It was because of her acute appendicitis. They only seek treatment when the pain becomes unbearable. Not injured by someone. Did you hear me? I don't believe it. The man who brought her here, he was her old flame from before she got married. Why would someone be so kind? There's definitely something fishy going on. Stand still. Otherwise I will be impolite to you. Open your eyes wide and take a look. She was in so much pain she couldn't even speak. It's not the kind of dirty thing you're thinking of at all. This. Besides, your wife is 28 weeks pregnant. It is the late stage of pregnancy. There is absolutely no possibility of having marital relations. Otherwise, both mother and child would be in danger. You don't know about this kind of thing? She is a mother of children. How could it not be clear? This. That's impossible. She was just arguing with me. How could this happen? Don't block the way. The patient is now in critical condition. The most taboo thing in late pregnancy. It means intense emotional fluctuations. It can easily induce serious complications. Hey, be careful. What's going on? Speak up. I know you're trying to scare me. Yes or no? I won't mention it. Wife, wake up. That's not right. This is so sudden. Why did the patient suddenly faint? Have no idea. Go help. Please make sure nothing happens. Immediately monitor heart rate and blood pressure. I suspect the patient has gestational hypertension. Early stage of disease. This is related to pregnancy. High blood pressure. In severe cases, it can cause convulsions and cerebral hemorrhage, even endangering the lives of mother and baby. Dr. Jiang, I'm going to push the monitor now. Wait. That's not right. What's wrong? My blood pressure can't be measured. No need to test anymore. The patient's convulsions were severe. Machine measurement is inaccurate. Replace with a mercury sphygmomanometer immediately. Arrange for someone to manually measure the pregnant woman's temperature. 10. Dr. Jiang. Pregnant woman's systolic blood pressure 288 mm of mercury. OMG. The most severe stage 3 hypertension criteria. It's only 180 mm of mercury. Stop standing there like idiots. Hurry up and bring the ambulance over. Hypertensive crisis in patients. There is a high probability of developing severe cerebrospinal fluid disease. Request an immediate obstetric consultation. Let the operating room prepare. The mother may need an emergency cesarean section. Daughter-in-law, how are you? I'm sorry. Don't be angry. It was my oversight. I shouldn't have let him take me to the hospital. But our parents are already so old. I couldn't bear to let them worry about it. You're busy with work and not at home. I was thinking of waiting a little longer until you come back. I really couldn't hold back anymore. I'm sorry, my wife. I was wrong. Ouch. It hurts. What's wrong? Honey, don't scare me. Wake up. Wake up, doctor. I am a beast. Please don't take offense at me. Please save my wife. Doctor, it's my fault. My wife is innocent. She was given an intramuscular injection of phenobarbital. The sooner the better. Guarantee depressurization and dehydration within 15 minutes. Good. Retinal congestion and swelling. Hypertensive crisis. Both lungs were filled with moist wells. Immediately notify the neonatal department. Arrange for incubators for premature infants. Send to the emergency room. Call more people to transfer the goods. The patient was taken for an emergency cesarean section. Dr. Jiang, please take a look. The bed is wet. Completion. The patient's water broke. What should we do? Please save her. Immediately place the pregnant woman in a head down, feet up position. As long as the amniotic fluid hasn't completely drained, both mother and child still have a chance. Do as Dr. Jiang says quickly. Lower the head of the bed and raise the foot of the bed. Tilt the patient. Is Dr. Jiang still going to the emergency room? Immediately notify the neonatal department. Incubator for premature infants. Send to general surgery. Contact the blood transfusion department. Emergency mass blood transfusion plan activated. At least 8 units of leukocytes are needed and 1000 milliliters of virus inactivated plasma. By the way, we performed an emergency seppuku. Bring the surgical instrument pack. Dr. Jiang, what are you planning to do here? Is it handmade surgery in the ward? This doesn't meet the surgical requirements at all. Life monitoring equipment, anesthesia machine, specialized operating table and various equipment. It has nothing. The most deadly thing is, we simply cannot guarantee sterility. Bacterial count exceeded standard in ward. Once the abdomen is open, the patient is at extremely high risk of infection. The consequences will be unimaginable. And this is during a life-saving operation. Perform a cesarean section. The surgery was several times more difficult than usual. We are all general surgery nurses. Obstetric surgery procedure, cutting selection, etc. I know nothing. There was no time to hesitate. I'm going to get the equipment. I believe Dr. Jiang can definitely save her. This gentleman. If you agree to the hand would go outside and wait. We will definitely do our best. Save your wife and children's lives. I agree to sign. Doctor, please. You must save them. I will. Don't worry. The real trouble is yet to come. Severe infection with high fever. Multiple organ failure is possible. Every level is extremely dangerous. Fortunately, the surgery was timely. The patient is young and has a good constitution. The characteristics and amount of the drainage fluid are acceptable. Hopefully, the tube can be removed smoothly in a few days. Ouch, my God, my old bones. What sins did they commit to be caught in such a once-in-a-century situation? On-site cesarean section rescue. Who would believe that if I told them? Even if this kind of thing is handed over to the provincial hospital, we'll be completely lost. I need to go check it out right away. Hopefully it's not too late. God protect the mother and make sure nothing bad happens to her. Xiao Jiang. Director Wang. Oh, Xiao Jiang, that's amazing. Your skills. It's like snatching someone from the jaws of death. Director, you've gone too far. By chance. It was just that it was handled promptly. Xiao Jiang remained as calm as ever. Today's desperate situation. Even if you force me to the heavens, I might not even have the courage to accept it. Why not, Xiao Jiang? There's another thing. The hospital has already made special approval. Give you surgical privileges. Drive it to the highest level. NOPU surgery. The dean said it himself. During the period when our department carried out laparoscopic technology. Everything operating as usual. You mean? That's right. The general surgery department was temporarily saved. That's good. Hey Xiao Jiang. Then you say, what should we do next, Director? Since we agreed to promote new technologies, just one step at a time, starting from the basics. Yes, it's best to proceed steadily and surely. I agree. In my opinion, we should start from. Let's have laparoscopic cholecystectomy. Cholecystectomy. This is in traditional open abdominal surgery. This is considered the ceiling for level 2 surgery. It will be directly upgraded to level 3. Xiao Jiang really dares to speak her mind. This can still be called basic. It's not us. Or maybe we should remove the appendix first. Oh. Xiao Jiang, I understand your intention. You want us to laparoscopic techniques in general surgery, winning at the starting line from the very beginning. That's why I want to have my gallbladder removed. This is a difficult surgery. What? Laparoscopic cholecystectomy. Is it difficult? Isn't this something anyone can do? What was the director muttering? I chose cholecystectomy as a way to promote laparoscopy, the beginning of new woodworking techniques. It's purely because of the gallbladder. It's not a big deal to cut it off. This gallbladder it is. Xiao Jiang, you only need to focus on the technology. Leave everything else to me. Clear. Then let's cut off the gallbladder. Let general surgery fight a brilliant comeback. Turn around. Dr. Jiang, you're finally done with your work. I've been waiting for you. Director Wang, when I interviewed Jiang Chenggang last time, I thought this young man. It all depends on the background. You can only get it through back channels. Director Wang's approval. Keep working hard. Push him into the public eye. Certificate. Rest card. Looking back now, that's a huge mistake. It was my petty mind that led me to this. Judging a gentleman by his own standards, Jiang Chenggang was able to win favor. They relied entirely on their genuine talent and skills. Certificate. Rest card. Dr. Jiang, I consider myself to have seen quite a few big scenes. But today, when I saw the patient with my own eyes, one person and one car were surrounded by you. When it was pushed out, that shot completely changed. I am a surgeon. Long-standing stereotypes. Is Dr. Jiang free right now? Certificate. SS card. I have some questions I'd like to ask you. Can. However, we can't delay for too long. I need to go get my medical records updated later. Okay, let's adjust the equipment. Start now. Oh Wang, to be honest, your apprentice is remarkable. Oh, how to say this person? Could it be that they're here to undermine us? Honestly, I'm a little jealous. Which department head doesn't want subordinates? There's a pillar of support. You didn't see it just now on stage. Dr. Zhong's continuous locking suture. No mistakes at all. I was completely stunned. Such a long incision. Several layers inside and out. He carried the equipment alone. No assistant needed at all. Sewing quickly and beautifully. The stitch spacing is the same as when measured with a ruler. You mean Jiang Chenggang's suturing skills are superior to yours? Not just me. Those who spend every day in the operating room. The expert who sutures blood vessels. They might not even be as good as it.